big group, all right, is a community based, and then intervention, the clinical trial is quite strict because, for example, a drug trial. So it is a clinical trial. Okay. So interventional studies either focus on the assessing change at the level of individual or the group. Right? Clinical trial basically we talk on the individual base. For the community trial is a group base. Okay. So there are two types of intervention trial. Okay. First one is the primary preventive type. Okay, which can be done on communities as a whole. So this is the community trial, primary preventive. So basically, when you talk about community trial, you are giving primary prevention. Okay, primary prevention. For example, okay, you want to do about weight reduction. Okay, weight reduction program in community. You want to give, for example, diet control. Okay, you give health education. All right. Okay, when disease not happen yet. Okay, when we talk about primary prevention, disease not happen yet. So, you want to, for example, prevention of CHD. Okay, prevention of CHD. So you know that CHD. What are the factors that can cause CHD? Okay, for example, high blood pressure, in terms of obesity, in terms of weight, in terms of sedentary lifestyle. So you prevent first. That means you go to the community and you can give health education. You can, in terms of weight reduction, all right, in terms of diet control, okay, in terms of food intake, okay. So you give the education first. That is the primary prevention. Okay, second type is the secondary preventive therapeutic type. Okay, this is mostly carried out on the individuals or patients in hospital setting. Okay, clinical trial. Okay, so secondary preventive is uh, patient is a patient. Okay, they have already got disease, right? So, for example, like drug trial. Okay, you are patient is already on the current drug. Okay, the normal treatment, but you are developing a drug that is better, in reducing blood pressure. Okay, so you want to try this drug, so you give the you will conduct the clinical trial to test the efficacy of the drug, whether this drug can reduce the blood pressure better than the current treatment, right? Okay, so clinical, we talk about clinical trial first. Okay, the common one is the randomized control trial. Okay, randomized control trial. RCT. Okay. Randomized, okay, come from the word randomization. Okay, control meaning that you have the control group, right? Okay, so in observational study, we don't assign them, for example, one group, okay, this group A, you smoke. Group B, you don't smoke. Okay, no, we don't do that in observational study. Okay, in observational study, we just observe. When we select the patient, when we select the participant is already smokers and non-smoker. After that, we observe them, for example, whether they develop lung cancer or not. All right. That is observational study. But in RCT, we assign them. Okay, we assign the patient to when patient come, when you do randomization, you don't even know as a researcher or as a patient, you don't know when you do we talk about blinding. Okay, blinding is, if let's say single blind, patient doesn't know, but researcher knows. Okay, if double blind, that means you yourself as researcher also, you don't know about the drug. All right, so it was labeled as A and B, but you don't know A, is it a new drug or a current drug. All right, so you will assign the patient. Okay, did you when a patient come, you go to drug A. Patient come, you go to drug B. Okay, so we assign them. All right, so that is the purpose of doing randomization. Okay, is to avoid bias. Okay, especially the selection bias. Right. So RCT, okay, RCT is a basically gold standard test of treatment. Okay, so the selection of group entirely random, right? When we start the intervention, when we start the trial, the control group and the treatment group must be identical. Okay, must be identical. So usually when we perform the statistical test, we will make sure that they are identical. Okay, they are identical between these two groups. Okay, what is the difference? Different is the treatment itself. Okay, because the control group maybe will receive the current drug, treatment group will receive new drug. Okay. Participant or investigators commonly blind. Okay, this is the one that I talked just now about the blinding. Okay, about the blinding. Right. Sometimes difficult for in a clinical trial in RCT to do blinding. Okay, blinding is not a must in the RCT. In RCT, the one that must is randomization because the word itself is randomized control trial. But blinding is not must. Okay, if you need to as much as you can, if you want, you can do the blinding, yes, you can try. But if let's say the treatment itself difficult to do blinding, for example, uh, one is using scope, okay, another one is open surgery, so how can you do blinding, right? So that one is difficult to do blinding. So it's not a must in the RCT. Okay, so RCT also can evaluate good and bad outcomes. Right. Okay, this is the simple example. Effectiveness of new antihypertensive drug. Okay, we have two design. If you still remember, we have parallel design. This is the common design. Right, common design. We have, for example, we have two groups: new drug and usual drug. All right. So we have like this example, we have two measurement only, baseline and also post assessment. Okay, so depend on how many measurement you want to take. Okay, that one is depend on the researcher. Another type is crossover design. So this one a bit complicated. Okay, a bit complicated because once for example group A receive new treatment, okay, this patient, this another group receive placebo, so after finish the post treatment and then do the washout period, you need to swap. Okay, you need to swap. So this crossover, it is better compared to parallel design. However, it is quite complicated, okay, in terms of the design itself and in terms of the statistical test itself. All right, so crossover is a bit is tough actually to do. All right, however, it is better compared to the normal, the parallel RCT. Okay, all right. So this when we perform the RCT, okay, RCT, uh, disadvantage of doing RCT is, of course, RCT is better. Okay, if you want to evaluate something, this new treatment, okay, RCT is the best option. However, okay, disadvantage is it is costly. Okay, costly and then also time consuming, and sometimes your dropout is quite high, right? Because you have, for example, you have 3 times measurement, right? So first baseline, okay, patient still come, right? Because you want to assess. Second time still okay. So after that, the follow up, then a patient is drop out. Okay, they don't want to continue anymore. So sometimes it's the dropout is quite high. Okay, in RCT, right? Because time consuming and of course costly. Okay, sometimes you have to pay the patient, not because of to pay them to participate in your study, but for example, you have to pay for their cost, for their traveling. Okay, they need to come to hospital to take the drug, so it's costly, so you need to pay for their transportation, so it's costly. All right, so that is the disadvantage of doing RCT. All right. And of course, if let's say you talk about crossover design, okay, crossover design is uh, it is more complicated, okay, more complicated compared to the normal parallel design, right? All right, that is the clinical trial. Okay, that is the clinical trial, right? In the second part, okay, any question before that? Any question with the clinical trial? before we go to community trial? Yeah. All right. Second part is the community trial. Okay. Community trial, I'm sure that uh, you have gone through before. Okay, about the community trial, but of course you did not do any study. It's just that you go to the community and then you, for example, you take their blood, you take their blood pressure. Okay, so you have been to the community. All right, but not as the, not to do the research. All right. Okay. So community trial, okay, is defined as a study that involves at least one intervention site in which a community-wide health promotion or disease prevention program is implemented. Okay, so at least one intervention site and at least one control site. So intervention site is the one that you want to give the intervention. All right. And then control site is, okay, without the intervention. Okay, that is studied concurrently. Okay, whether or not randomization is used to assign communities to treatment groups. So in community trial, most of the time, randomization is not applicable in community trial. Okay, because it involves uh, a community. Okay, it involves a group. So difficult to do the randomization. All right. So, uh, like just now in clinical trial, randomization is almost compulsory. Okay, for example, when you do RCT, okay, it is compulsory if you term as RCT to do the randomization. But in community trial, sometimes it cannot implement it. Okay, so that's why in community trial it's not compulsory to perform the randomization. All right. So in community trial, okay, the treatment groups are communities, okay, rather than individuals. Okay, for example, we go to school, we go to health facility, we go to kampong, all right, we go to youth club, all right. We sometimes go to, like if let's say the kindergarten one, the tadika, all right. So this community trial is okay, appropriate for diseases that have their origins in social conditions, okay, that can be influenced by intervention directed at group behavior as well as individual, right? Okay, for example, when you give health education, all right, you give in the group, all right? So when they perform, for example, they hand washing, okay, you talk about hand washing, so in school, so it influenced by others also, okay, if a few people do, others also will follow, right? Okay, so aim at intact social group for prevention of disease and promotion of health, right? Okay, for example, I used to do last time when H1N1, I was doing master last time, okay, H1N1. So I did the health education among in the secondary schools. Okay, so when you perform community trial, you must make sure that your school are far from each other, right? You cannot do, you cannot select one school. After that, uh, you select this class is for intervention, another class is for control. You cannot do that, okay, because we call it a contamination effect. Contaminate, okay, like you do in lab, right? You is contaminated. So in community trial also we call it contamination. Okay, we want to avoid the contamination happen. All right, so we need to make it far from each other. Okay, far from each other. Okay, control group in, for example, control group in Gombada. All right, and then you want to talk, you want to do intervention, okay, maybe in town. All right, okay, so far from each other, right? So we this school, okay, you need to choose purposely. Okay, sometimes difficult to do randomization, so we purposely choose. Okay, this school in Kuala Nerus we will do as a control. In town we will take as a intervention. All right. So you have to select far from each other. Right. Okay. For community trial, okay, we are interested to talking. We are in for the reduction in risk factors. Okay, because when you are your aim is to reduce, okay, the risk factors, the impact will be the health status of a community. All right, you have targeted already inside that community their for example, maybe their lifestyle. Okay, they are a very sedentary lifestyle, and they are obese, for example. So you want to reduce the risk factor. Okay, so why the purpose of you want to reduce the risk factor is you want to make sure that you want to see the health status of that community become better, right? And then change to healthier lifestyle by high risk group. You aim, that means that group already, okay, they are quite high risk. Okay, in the you go already to that village, you have seen the people around there, all the young people, they are obese, right? They don't do any activity, so they are high risk group, right? So you want to change their health style, okay, to become healthier lifestyle. So okay, so when you change their health style, at the same time they will change the behavior of other members of the society. All right, so intervention aim and focus at specific diseases. All right. Okay. For example, heart disease. Okay. So you focus on that heart disease. Or for example, you talk about the cessation of smoking, right? All right. So you want to reduce the lung cancer. Okay. So you focus at that specific diseases. Okay. So when you focus at that specific diseases, okay, it will affect the incidence or cause of other diseases. Okay, sometimes disease like for example, cholesterol, hypertension, they are linked to each other, right? So when you focus on to reduce the blood pressure by giving the healthier lifestyle, so it can lead to reduce other diseases as well. Okay. So health activities in communities, okay, enhance the confidence in the people and thereby their involvement and acceptance. Right. So most important thing is you need to have compliance and involvement of people in the community. All right. That's why uh, before you go, even yourself now you are doing the project, right? You go to that place many times just to get their confidence, right? Confidence of the people. Okay, when you have the confidence of people, the involvement will be better, right? Then can improve their involvement when you do a community trial, right? So the objective of the community trial is, okay, basically you want to increase their health knowledge of the whole community, okay, and then you want to develop positive and right attitude in the community, okay, and then to increase the practice of positive health behavior of the whole community. Okay, thereby this is part of the health education. Okay, to increase when you give health education, you get increase their health knowledge. Okay, when your knowledge is high, okay, you have your knowledge already, and then you can have a correct attitude. Okay, you have correct attitude, positive attitude, and it will implement in your practice. Okay, so you will have a good practice, a positive practice. So all this can prevent early diseases and death in the community, right? So that's why if let's say you used to receive a questionnaire about KAP, right? What are these actually? Okay, to see your knowledge level, all right, and then if you have good knowledge, by right you should have good attitude and good practice, right? So this health education is basically part of the primary prevention. Okay, part of the primary prevention. All right. So that one is about the community trial. Any questions so far? I think this is quite straightforward. Yeah. All right. In uh in the trial itself, there are few, we call it a design. Okay, like for example, quasi experimental type. Okay, this quasi experimental type is also one of the trial. Okay, one of the trial. However, this type of design is randomization is not there. Okay, when you do a trial, okay, you cannot, let's say it is difficult for you to do randomization, right? So you cannot term your study design as RCT. Okay, you cannot term your study design as randomized control trial because you did not do the randomization. So you can term your study design as quasi experimental. Okay, quasi experimental design. It is a trial also, but when we heard about quasi experimental, then we know already that means you did not do the randomization. Okay, you did not do the randomization. Okay, all right. So they will not be having as much of a chance of random allocation. Okay, so random allocation is not there. Okay, when you do the this design. Okay, so it is desirable to have almost identical reference and intervention population to get the result, the valid result out of the community trial. Okay, this quasi experimental can be a clinical trial, can be community trial. Okay, the concept is easy. If the randomization is not cannot be implemented, okay, so you can term as quasi experimental design, right? Okay, this is another one, nested or embedded design. Okay, okay, right. Okay, so sometimes, okay, this is the explanation. Okay, sometimes several intervention and reference community may be embedded in the whole country or region, and their test results are compared. All right. So in, for example, in Malaysia itself, okay, actually there are many community trial going on. It's just that we don't term directly that is a community trial. Okay, for example, what government did on the, I think no more now, right? The tak nak, the smoking one, right? About tak nak, and then it happened in many region. Okay, happen in many region. So, and then after that, the result is compared. All right. And then what else? For example, about the COVID. Okay, about the all those wash hand, wear mask. Actually, that is indirectly they give you the intervention. Okay, they give you health education. All right. After that, they will see. Okay, they will see based on the region. They have the statistic based on the region, right? So that what it mean by this nested or embedded design. All right. So you have the reference population. That means you have the bigger population, Malaysia itself, and then inside there you have many the nested design. Okay, you maybe in Malaysia based on the uh, each of the what state. All right. Okay, so that what it means by this nested design. Okay, so this design will help in reducing the biases and increase the validity of the trial and allow for generalization to similar population and for policy formulation. Okay, it is for generalization because if you do one state only, you cannot generalize it to the whole Malaysia. So that's why they do based on states. Okay, so presence of medical services and medical treatment also should not differ in this population. All right. So uh, you give you talk about hand washing, you talk about the to reduce the COVID. Okay. So all these state must have same same medical treatment. Okay. Um, that is to reduce the bias. Okay, so improve medical treatment in one community will have a positive influence on morbidity and mortality, thereby affect the endpoints and evaluation. So if let's say that state give better in terms of medical treatment, then you can see, okay, their morbidity and also mortality improve. Okay, right. So that is the design that is part of the community trial. Okay. All right. So this is the differences the comparison, okay, between community trial and also clinical trial, right? So when we talk about community trial, okay, the outcome you measure as measures the exposure and outcome under less well controlled condition. Okay, different from clinical trial. Clinical trial is quite controlled, right? You control the situation, right? It's quite strict, right? Community trial, we talk about measure effectiveness. Okay, clinical trial is about efficacy. Okay, community trial involve whole communities or populations. That means bigger group. But for clinical trial, we talk about individual. Okay, in community trial, we ask. Okay, that means we have to answer the research question that does the treatment work in practice under day-to-day condition which apply in the real world. All right. Okay, this is about, we talk about practice, right? But for clinical trial is you want to test the theory. Okay, you want to test you have for example this drug, you you have theory only that this drug is better because you don't implement yet. Okay, maybe you have done among in the animals, but it's a theory only. So now you want to implement whether can be imposed in the real world or not, right? Okay, so major objective in the community trial is to assess factors which affect the implementation. But in clinical trial is about the causal mechanism, whether this drug can reduce the blood pressure or not. Okay, causal mechanism. Okay, so there are many intervention methods. Okay, so the idea is to bring about the attitudinal changes in the people to alter their negative lifestyle and to sustain. Okay, so this idea can be achieved by means of several social skill learning techniques. All right, so these are the few examples that in the community trial. All right, the method, okay, that can implement in the community trial. Okay, the one that lists down here, there are four of them. Okay, we talk about social cognition or learning. Okay, and then intervention by reason, action, and plan behavior. Okay, this is the second type. And then by persuasive communication. And then we have one more is social marketing intervention. All right. So let's see. Okay, so you wait for. All right. Okay, so see the first one. First one is about you give the intervention by uh, social cognition. Okay, for example, uh, pop star. Okay, like a very uh, the players international players, right? You give the uh, you give by using the model, okay, the important model for them to change. All right, when they see this top star, okay, so they will uh, try to change indirectly. Okay, so that is social cognition, right? And then we have by reason, action, and plan behavior. Okay, for example, okay, where the change can brought about by adapting the information given by creditable person first, and assessing it by self-management later. For example, okay, for example, by learning the necessary skills, right? You give the uh, certain skills, all right, and then okay, that is the reason for them to change their behavior after that, right? And then we also have, okay, by communication. All right, communication is nowadays, all right, not only by television, but there are many types of communication. For example, it's even inside your phone itself. Okay, so there are many information can be delivered there. Right, so that is a persuasive communication. Okay, not only you need to give a talk, right, but by giving information, the correct information through the mass media, also can be one of the type of intervention, right, that can change your lifestyle, right? And then social marketing intervention. Okay, okay. Preventive health services are the products to be marketed, and the target audience, cost, and benefit have to be defined. Okay, so this one is about social marketing. Okay, so proper messages have to be developed, and effective channels for acceptance have to be selected. Okay, sometimes when we talk about a product, okay, certain product, if you take this kind of product, is you can uh, uh, help in reducing your body weight, for example. Okay, so it's one type of the social marketing. Okay, all right. So after you give all this intervention, either by community trial or clinical trial, you need to evaluate. Okay, you need to evaluate. So the outcome, okay, the evaluation of the outcome must be measured, okay, simultaneously in both of the communities. Right. That means you need to evaluate. If let's say you have control group and you have intervention group, okay, even though control group is only given a placebo, only given a not related to the intervention study, but you still need to evaluate. All right. So in endpoint to be measured, all right, changes in knowledge, attitude, and practice. Okay. This one is of course, depend on your research question, right? Depend on the objective of the study. All right. And then you can also the measure mean and prevalence of risk factor, symptoms, sign, pain reduction. Okay, specific morbidity. Okay, morbidity obtained. This is usually we obtain from the practitioners, hospital. Okay, availability of medical services and treatment. Specific mortality rates of the most common diseases. Okay, total mortality in the both community. So morbidity, mortality, we will learn about this. Okay, morbidity and mortality. Right. So this is some of the endpoint. Okay, endpoint that you can measure you can evaluate after you give the intervention. Right. So population surveys are carried out both in the reference and intervention population, okay, simultaneously. Okay, most of the time we do 3 times, okay, before, during, and also after intervention. Okay, so but sometimes you need to take more. Okay, for example, a drug. Okay, you cannot just observe 3 times and you can say that okay, this drug can reduce the blood pressure. Okay, sometimes you need to take more times. Okay, so an additional survey has to be carried out after some years to know about the persistence of the altered behavior practice. Okay, so but most of the time for community trial, we evaluate only during the our trial only. After that, we don't do any follow up. Okay, that's why, because the behavior sometimes is not sustained. Okay, maybe after 2 weeks, that's all. You don't do any anymore, and people will go back to their old lifestyle. Okay, that's why you need to have persistence, follow up. Okay, follow up with the community. Okay, to make sure that the behavior is already with inside the them. okay, inside them. That means they already adapt to that kind of healthier lifestyle, right? So whatever come, they won't change their healthier lifestyle, right? Okay, so techniques of measurement, okay, can be as simple as questionnaire. Okay, questionnaire, you can do interview, or you can use by using analytical methods. Okay, for example, lab tests, right? For physical and biochemical parameters. So that means is this one is the like you know the blood parameter. So okay, you want to see whether uh after you giving the health education, is it okay to high risk group? Before that, when you do the baseline, their cholesterol is high, for example. Okay, so after giving the health education about proper diet control, and then you measure again after maybe few months, okay, you will see whether are they improving or not. Okay, that means you measure again the cholesterol level. So that is by the blood parameter. Okay. So variations can occur during collection. Okay, so this one you know better than me in terms of collection, testing, okay, storage of samples. All right. So seasonal variation can also occur in risk factor levels, and if not considered, will cause serious lapse in measurement. Okay, so this one is about the when you talk about the blood collection, about the this blood parameter. Okay, so you need to consider all these things during collection, testing, and so storage, right? All right, so advantages, okay, represent the only way to estimate directly the impact of changes in behavior or modifiable exposure on the incidence of diseases. Okay, but these advantages of community trial is, of course, it inferior to clinical trials. Okay, in terms of with respect to ability to control entrance into study, okay, delivery of the intervention, and monitoring of outcomes. Okay, and then fewer study units are capable of being randomized, which affect the comparability. Okay, like community trial, difficult to do randomization. Okay, so you need to be careful in terms of the comparable group. Okay, and then affected by population dynamic, secular trends, and non-intervention influences. Okay, for example, you want to reduce the your aim is you want to reduce the uh, BMI. Okay, but there are many other non-intervention influences. Okay, you cannot control them, difficult to control. That's why community trial is less control uh, trial. Okay, compared to the clinical trial, right? So limitation is only a small number of community can be included, right? So random allocation of community is usually not practicable. Okay, and then changes in mortality and morbidity take several years to occur. Okay, so if you do a short study, difficult to see the changes. Okay, so other methods are needed uh, to ensure any difference found can be attributed to the intervention rather than to any inherent differences between the community study. So when we compare the community, okay, baseline must be comparable. Okay, baseline must be comparable. All right. So community trial, okay, how to compare in terms of their socio-demographic, their cultural differences. So it's not easy. Okay, it's not easy to control this thing. Okay, sometimes you want to give talk about the diet, but they have been eating, for example, santan since small. They eat, and then you want to change the diet, so it's difficult. All right, so that is the cultural, okay, cultural differences. Okay, maybe when you talk about to reduce santan among Chinese, of course they can adapt better because for them is they are not used to the santan, all this kind of food, all right, compared to Malay. All right, so that is the difference. So difficult actually to make sure that these group are comparable in the community trial, right? Okay, so it is difficult to isolate the communities where intervention is taking place from the general social changes that may be occurring. So when we that's why not easy to isolate the control and intervention group. All right. Okay, the one that I mentioned just now about the contamination. That's why you need to be far from each other. Okay, to make sure that this contamination effect is not happen. Right. So because when the contamination is there, it is serious flaw. All right. Your result is not valid anymore. Okay. Same thing like when you do a lab. Okay, you have the contaminate is contaminated already, so you cannot do anything. All right. So it's a big loss if you do a big project. Okay. So these are the examples of the project, okay, of the community, the big community trial that have been done. Okay, this is not in Malaysia, right? It's quite sometime already. This one, like for example, 1986. Okay, is but what I want to show here is a long study. Okay, community is a long study, 4 years. Okay, here is you want to talk about the smoking cessation. Okay, smoking cessation. So 4 years uh, to give the public education, right? And then this one is about the vitamin A supplementation. Okay, 2 years, right? You want to give the vitamin A supplement to the children, right? To children, right? This is RCT. Okay, RCT, but among the community. Okay, RCT also can be done among community, right? And then this is North Carolina project. Okay, so this is quite long, 10 years intervention. So this intervention is actually for the cardiovascular risk factor, the reduction of cardiovascular risk factors. So it's 10 years intervention, right? And then this is about coronary also. Okay, this is 4 years intervention. Right. So if you see the intervention itself, they give about the this is quite old, 1979, long time ago, right? But they talk already about the mass media, right? Interpersonal intervention, okay, about the and then direct about the reducing cholesterol, blood pressure, about smoking, about stress, okay, about the physical activity, okay. So this is the it has been used long time ago, all right, about the how to change your behavior, right? Okay, this is 5 year study. So this is Stanford Five City project. All right. So this one is okay, same thing. About the to reduce the cholesterol also, blood pressure, smoking, weight, okay, increase physical activity. Basically, community trial is for the non-communicable disease. Okay. Most of the time when we do community trial about non-communicable diseases, but there are also for the communicable disease. For example, like just now I did on the H1N1. All right. But that one is a, not a long period. Okay, it's a short period of time, so you can perform that kind of health intervention, right? So depend on disease itself. Okay, right. So this one is another one is about the heart health program. Okay, the 5 to 6 years intervention, right? So this one also about heart, about the cardiovascular diseases as well, right? Okay, so basically what we have learned today is about clinical trial and about the community trial, right? So most of the time, uh, when we talk about efficacy of the new treatment, okay, either drug or either any type of treatment, okay, we need to do based on the individual, okay, based on the individual, right? Because if you are interested on patient itself already got disease, so you will talk about clinical trial. But when you want to talk about the primary prevention, all right, disease not happen yet, okay, primary prevention, we want to reduce, okay, the incidence of the disease, then we can perform the community trial, right? Okay, any question? I think it's the last one already. Anything? Anything you want to ask about this community trial and clinical trial?
Doktor jangan sesuai saya. Jangan. Doktor, saya nak tanya,
Ya.
kalau untuk clinical trial tu, macam
Mm-hmm.
kita kan nak buat intervention ke orang tu. Jadi untuk kita monitor dia tu macam mana?
Hmm.
Macam kita duduk rumah dorang ke? Dorang duduk satu tempat
Uh,
yang kita isolate ke?
okay. Alright. Thank you. Alright. Okay. For clinical trial, okay, we cannot ask them to stay in one place. Contoh drug, right? How can you ask them? Because it takes time to reduce the blood pressure. All right. So you cannot take one drug after direct reduce. No. All right. So you just ask them to come at this time, and they need to follow up. Right. You need to follow up them. That means you cannot stay with them. You cannot, right? What you can do is, all right, you give a point for them. Okay, this baseline you come after that. So you talk the first thing. That's why you need to give trust first. All right, communication is important. All right, so you need to give trust to this patient. All right, why I'm giving you this new drug? All right, why I want to test this new drug? Because it's better to reduce your blood pressure fast. All right, so they need to come, okay, many times to for follow up. That's why I said just now, the disadvantage of doing RCT is dropout is high. Okay, dropout is high. Sometimes you need 100 but end up only 50, 60 because dropout is high in the trial. Okay, they patient, especially old people, they come one, two times after that, that's all. They don't want to follow up anymore. Right? So that is disadvantage. So because you cannot stay with them. Okay? You cannot stay with them and you cannot control their food also. All right. So it is as much as you can to try to avoid the bias. Okay? Uh,
Faham doktor, faham.
okay. All right. Any other question? Any other question? No, huh? All right. So if no question, then this Wednesday we can do class as usual, right? You don't have any program, right? This Wednesday.
Ya doktor. Tak ada. Boleh doktor.
Boleh, huh? All right, good. Okay, so so we have finished already about the study designs. Okay, so this Wednesday, inshallah, we will talk about the different topic. Okay, I think natural history of disease. All right. Okay, so I will see you this Wednesday, inshallah. All right. Okay, so if no question, I think that's all for today.
Ya doktor. Thank you doktor.
Okay. All right. Thank you, everyone. Okay, Assalamualaikum.
Waalaikumsalam. Thank you, Doctor.
Terima
Welcome.
kasih doktor.
Nama.